We are aspirational for what's possible, and we are thinking ahead of what is next. Our goal is we want to open up summer camps, schools, and youth activities. So we are planning ahead, and all the evidence that we've seen over the last 4 or 5 weeks say that it is responsible and prudent to plan ahead for schools, summer camps, and youth activities. So we're working with the education community, school leaders on a plan to safely resume school in the fall. We're going to return the Arizona way. It's going to continue to be gradual and phased in. We're going to balance and prioritize public health and returning stronger. We're going to increase testing to return in May while maintaining physical distancing. So this idea of physical distancing, staying 6 feet away, is important that we continue that. And lastly, we're going to have a phase-in return based on the recommendations of the CDC and health experts and guided by public health as we continue moving forward. Now, we talked a bit last week and the week before about returning stronger in our economy and turning the dial on the light switch to bring back the energy which Arizona's economy had just 12 weeks ago. There were people, and are people, who were displaced. Over the last several weeks, over $777 million has been dispersed in unemployment benefits to the nearly 500,000 plus hardworking Arizonans that were doing great 12 weeks ago and suddenly found themselves without a job. We realize the stress that's been on the Department of Economic Safety, Economic Security. I want to say thank you to Tom Betlak, to all the hardworking employees that are there, the new employees that have come on board so that they can answer these claims. We're starting to see these claims go in the other direction, but we want to make certain that everyone that needs their unemployment insurance benefits can get their unemployment insurance benefits.
So the first project that we're working on is skilled nursing facility testing. So these are our Medicare certified skilled nursing facilities. There's 147 of them statewide. So we discussed this last week as we were talking about what we were going to do to protect those vulnerable adults in this congregate setting. We started our first long-term care facility testing last Friday on May 15th. We continue to do that. We're working with a contractor that's going out to the facilities. We can do up to 12 facilities per day, and so we're working to meet that 2-week requirement. We are doing PCR on residents and serology and PCR on staff. In addition, we'll be providing the facilities with the test results, providing them technical assistance on infection control guidance that's tailored to their specific facility and their specific situation. We're providing them with personal protective equipment, or PPE, so that if they do have positives that we identify, they can adequately control transmission of that disease. We are also providing assistance with staffing to get people in there just in case we've got staff that test positive and need to be removed from the workplace. And then we are also working on a plan to, if requested by the facility, to provide terminal cleaning. So a final clean, and then they can move on. The other thing that we're doing is we have reached out and done phone infection control technical assistance, and so we have reached out to 100% of those 147 skilled nursing facilities where we've walked through the CMS infection control guidelines and requirements. Our goal now is to be on site at every single skilled nursing facility to complete that infection control survey by June 5th. And so all 100% of our skilled nursing facilities will have a survey by then. Now, not all long-term care facilities are Medicare certified. So we have assisted living facilities in Arizona that are not Medicare certified. They are state licensed. So as soon as we have gotten through the skilled nursing facilities, we will begin to test in our residential facilities. So these will be assisted living facilities or centers. Those are facilities that have 11 or more residents living at them. And then assisted living homes, which is the majority of our assisted living facilities. And those have 10 or less residents. So we'll be working with them. But again, we have reached out to 100% of our assisted living facilities to provide technical assistance on infection control, to make sure that they understand how the executive orders apply to them, and then to provide any technical assistance that they may need. And then we are also working to do focused infection control surveys at assisted living centers that have identified issues. We continue to partner with the Arizona Department of Corrections, Rehabilitation, and Reentry, and we are working to expand testing capacity for our inmates and correctional officers. So currently, we provide testing for all symptomatic correction officers and then inmates with COVID-like symptoms. So moving forward, we are partnering with the University of Arizona to offer antibody testing of all correctional officers. Initially, that was just going to be for the 9,000 state correctional officers that we have. But as we were reviewing, what we identified was that a lot of the contractors that the Department of Correction uses do come into contact with correction with the inmates. So we are expanding the antibody testing to include all healthcare workers, first responders, correctional officers, and the contractors at our prisons statewide. So that'll be about 16,000 correctional officers and contractors. We're working with the U of A. They have sites that are set up statewide where the correctional officers and the contractors, we will provide the transportation to go there. There are a couple of facilities that are very rural, so we will be working with those prisons to send our contractors out, our blood draw contractors out to go draw the specimens at those facilities to make it easier for those individuals that work there. We're also working on contact investigations. So this would be if there was an identified COVID case in a prison, we would then work with the prison to do testing of any of the inmates or workers that come into contact with that individual so that we can do an epidemiological investigation and make recommendations. We are also working to provide on-site technical assistance with infection control at the prisons, and are working with the prisons to do that at all of the locations statewide.
We have a very limited amount of medics in the Guard, but what we try to use those medics and dedicated personnel for is to triage while we come up with permanent staffing solutions. We were able to do that both at Chinle, for Arizona Guard, and the New Mexico National Guard at Shiprock, creating up to 100 additional beds. We're providing 12 permanent staff up there, split between medics and logistics support staff, as well as the folks that are operating in the Emergency Operations Center in Navajo County, as well as assigned to the Navajo Nation Incident Command System. And finally, beyond all that, as you've heard me say before, one of the things we talk about in the Guard is always ready, always there. We have worked hard to help triage the need for food, ice, water, and medical supplies throughout the nation, including the delivery to 4 of the chapter houses of 5,000 gallons of potable water that helps with the cleanliness, sanitation, and obviously health and sustainment of those communities. And we stand ready, sir, to continue to help them with all of the support we're receiving from donor groups, as well as our federal partners and other state agencies.